So if you remember, I have started with the submandibular region. Now from where to where the submandibular region is extending? Anyone? Submandibular region, from where to where it is extending? It is extending from the mylohyoid line of the mandible to the hyoid bone. That is the extent of the submandibular region. Now in the submandibular region, you will be getting the contents of submental triangle and the digastric triangle together. Along with that, you will be getting some structure of the floor of the mouth, along with that the dorsum of the tongue. These are the deeper structures situated within the submandibular region. Okay. Now, do you remember the contents of the submandibular region? Do you remember the contents of the submandibular region? In submandibular region, first of all, wait, let me show you the diagram. If you remember this diagram, okay, this is the diagram showing the submandibular region extending from the mylohyoid line of the mandible up to the hyoid bone. Okay, and as I said, deeper structure includes the floor of the mouth and dorsum of the tongue. Those structures are also included, but those structures are situated deep in the submandibular region. Next, what are the structures present in the submandibular region? First one is so many structures are there, and all the structures are not situated in same plane. The structures are oriented in different planes. Okay, so you can't see all the structure in one diagram. So you have to use multiple diagrams, multiple planes in order to see the structure. Now, in case of submandibular region, the important structures, whatever you can see in the diagram, first of all, suprahyoid muscles are there. If you remember, suprahyoid muscles. How many suprahyoid muscles are there? 4. Okay, 4 suprahyoid muscles are there. Next, apart from the suprahyoid muscles, we have seen the extrinsic muscles of the tongue. Yes, you come and sit over here in the first bench. Take out your notebook, pencil or pen, and then sit. Okay, next, extrinsic muscles of the tongue. Okay, how many extrinsic muscles are there? 4 extrinsic muscles are there. Everything were discussed that day. Along with that, what else we can see? Blood vessels are there. If a region is there, in that region, if different structures are present, muscles are there, that means nerves will be there, blood vessels will be there. Okay, so the most important artery over here is the lingual artery. Next, what are the different nerves we have studied in this particular region? Lingual nerve is there, glossopharyngeal nerve, hypoglossal nerve. Okay, so the nerve which we have studied over here, I have given a brief description about those nerves. Next, the most important 2 structures which you can see in this region, these are the submandibular salivary gland and sublingual salivary gland. So during the time of dissection, I hope you have noticed that I have shown you the submandibular salivary gland, and even I think I have shown the sublingual also, but that we have not discussed till now. We will be discussing. Okay. Another important structure which is present in this particular area, that is the submandibular ganglion. Submandibular ganglion. Now today we will be discussing first of all what exactly is this ganglion. Okay, because in head and neck phase different ganglia are there. Okay, for example, submandibular ganglion, otic ganglia. Okay, pterygopalatine ganglion, like these different types of ganglia are present. Now what exactly is that ganglia? If ganglia is there, then what are the connections? Which type of ganglia it is? That we will discuss. Because if you have studied about the nerve supply of submandibular salivary gland, I don't know whether you have studied or not. If you have studied, then you will see that a chart is given. You take any book, a chart is given. Okay, and in that chart, from where the fibers are coming, where it is going, it is mentioned. Okay, in that this particular ganglia is responsible. Okay, so we'll try to understand the concept of this particular ganglia which is present in this region, and this is very important. Now, last week I still remember that I have explained up to lingual artery. Okay, so what do you think? What is the origin of the lingual artery? Facial artery is also there and lingual artery is there. Facial artery already we have discussed. Okay, we will be discussing about the lingual artery. Now, what is the origin of the lingual artery? It is a branch of external carotid artery. Okay. Now, if you see the origin, it arises from the tip of greater cornea of the hyoid bone. That is the origin. And after that, the hyoglossus muscle. Now, can anyone tell me which is the key muscle of this region? Hyoglossus. Hyoglossus is the key muscle of this region. So this particular muscle, what it will do? It will divide the lingual artery into three parts. First part, second part and third part. Okay, these are the... Okay, so this lingual artery, as I said, it is divided into three parts. By which muscle? Hyoglossus muscle. Okay, first, second and third. Now if you see the first part, where it is situated in the carotid triangle. And the first part is having loop-shaped course. If you see the course of the first part, it is loop-shaped. Let me show you the diagram. Can you see the diagram? Can you locate where the lingual artery is situated? See, this is the lingual artery. So this is the first part, this is the second part, and this is the third part. Now in relation to this, you can see the hyoglossus muscle. This is the hyoglossus muscle. Okay, the key muscle of the submandibular region. Now if you see first part which is coming out from the external carotid artery opposite to the greater cornea of the hyoid bone. Okay, next if you see the first part, it is loop shaped and that loop is crossed by hypoglossal nerve. As you can see, hypoglossal nerve is crossing the loop of the lingual artery. Now this particular loop is very important. Why? Because this loop allows the movement of the hyoid bone. That's why the loop shaped course is there of the first part. Next, if you see the second part, so which is the second part of the artery? Can you see the diagram? Now in the diagram you can see the second part is situated behind, or you can say deep to the hyoglossus muscle. Okay, hyoglossus muscle is there, deep to the hyoglossus muscle, the second part of the artery is situated. Okay. Next, you can see this is the third part of the artery. Now third part of the artery is having two courses. First you can see the vertical course and then you can see the horizontal course. Okay. So see, this is the vertical course. I hope you can see the vertical course, and then you can see the horizontal course. Okay. So that is under third part. So like these three different parts are there. Now the third part is also called as deep lingual artery. Third part of the artery is called as deep lingual artery. Now if you see the third part, the vertical course, it lies between the genioglossus and inferior longitudinal muscle of the tongue. Okay, genioglossus and inferior longitudinal muscle of the tongue. In between that, the vertical course is present, and the horizontal part is accompanied by lingual nerve. So this is the horizontal part and it is accompanied by the lingual nerve. Okay. Next, so if lingual artery is there, it will be giving some branches. Okay. So what are the different branches given by lingual artery? First of all, suprahyoid branch. Suprahyoid branch. Suprahyoid branch are for suprahyoid muscles. Okay. So those muscles are supplied by the lingual artery. Next, dorsal lingual, sublingual and deep lingual arteries. So those will supply the tongue. Then it supplies the floor of the mouth. It supplies the submandibular gland, sublingual gland. Okay, so this entire area is supplied by the lingual artery. Okay. So this is also a content of the submandibular region. Next content of the submandibular region are the veins. Can you see the veins in the diagram? See, these are the deep lingual veins which you can see. Then here you can see the vena comitants which are accompanying the hypoglossal nerve, and here also you can see the vena comitants which are accompanying the lingual artery. Okay, so veins are also present in this particular region. So these particular veins draining the area where they will go, ultimately they will go and drain into the internal jugular vein. Sometimes it drains into the common facial vein, and sometimes it drains into the internal jugular vein. Okay, so in a particular region, if blood vessels are there, that means you have to describe separately about the arteries, okay, and separately about the veins. So in this diagram, I hope you can see the veins also. So in the submandibular region, the muscles already we have discussed, nerves also we have discussed, blood vessels, the main artery, lingual artery and facial artery. already done along with the veins. Now we'll go to the most important, one of the most important content, that is the submandibular ganglion. Okay. Now veins already I have shown you in the diagram. Okay, so vena comitans nervi hypoglossae, which is accompanying the hypoglossal nerve. Okay, two veins are there. Next, vena comitant, again two veins are there which accompany the lingual artery and run deep to the hyoglossus muscle. Ultimately, what will happen? They will join to form the lingual vein and it drains into the common facial vein of internal jugular vein. Okay, this is how the venous drainage of this particular area is taking place. Two sets of veins are there. Okay, vena comitans nervi hypoglossae. This means these are the two veins accompanying the hypoglossal nerve. And vena comitans, two veins again accompanying the which artery? Lingual artery. Okay, ultimately they will join to form the lingual vein, and that lingual vein, where it drains into either internal jugular vein or common facial vein. Okay, so that is all about the venous drainage. Next, the most important part, that is the submandibular ganglion. Now you have to understand the concept of the submandibular ganglion, because see, muscles you have studied so many times. Skeletal muscle, what is the origin, what is the insertion, nerve supply, action, this you have studied. You have the concept of muscles. Next, about the nerves you have studied. Okay, from where it is coming, where it is supplying. Okay, you are having the concept. Next, you are having the concept of blood vessels also. Okay, but this thing I don't think so you have studied. This you will be studying for the first time. That is the ganglion. Now, what exactly is that ganglion? Anyone? Yes? क्या होता है ganglion? Okay, so what exactly is this ganglia? Ganglia are collection of nerve cell bodies outside the central nervous system. That is ganglia. Okay, so as I said, two types are there. Can anyone tell me what are the two types of ganglia? Okay, sensory ganglia and autonomic ganglia, two different types of ganglia are there. If you see the sensory ganglia, they are present at the dorsal root of the spinal nerve and some trunks of cranial nerves. For example, fifth cranial nerve, facial, okay, fifth, seventh, ninth. So these are the trunks of facial cranial nerves. Over there, you will be getting the sensory ganglia. Next, if you see the autonomic ganglia, it is again divided into sympathetic and parasympathetic. Okay. Now, if you see the sympathetic and parasympathetic, so the submandibular ganglion, whatever I have mentioned over there, this is the parasympathetic ganglion. Now, in case of parasympathetic ganglia, they are situated okay, and in case of sympathetic, again it is of two types. Okay, so in case of sympathetic, again it is of two types, paravertebral and prevertebral. Paravertebral means sympathetic chain which are situated on the either side of the vertebral column. That is the paravertebral. Prevertebral means which are situated in front of the vertebral column. For example, celiac ganglia is there, superior mesenteric, inferior mesenteric. Okay, those are prevertebral. So these are sympathetic ganglia. Now in case of parasympathetic ganglia, the ganglia are situated near the wall or embedded in the wall of the viscera. Okay, that is the parasympathetic ganglia. So this is the overall classification of the ganglia which is present in our body. Further description, you have to know that in each and every type of ganglia, which type of neurons are present. Okay, that will be discussed in the neuroanatomy part. So I hope it is clear what is ganglia and what are the different types of ganglia. Right? Now the submandibular ganglion, whatever we'll be discussing today, that is under autonomic, that also parasympathetic ganglion. So submandibular ganglion, as I said, as I mentioned over here, that is a parasympathetic peripheral ganglia. Okay. Now all the ganglia, whatever they are present, they are acting as a relay station. Okay, they act as a relay station. Now in this particular case, the submandibular ganglion is acting as a relay station for secretomotor fibers. Okay, secretomotor fibers, especially for submandibular and sublingual salivary gland. What is the function of sublingual and submandibular salivary gland? Salivary gland का function क्या होता है? What is the function of sublingual and submandibular salivary gland? To produce saliva. Okay, so whenever the saliva is produced, okay, it has to be controlled. How it will be controlled? It will be controlled by the secretomotor fibers. Okay, so those secretomotor fibers, they are coming through that particular ganglia. Okay, that is the submandibular ganglia. Now if you see the submandibular ganglia, topographically it is related to the lingual nerve, but functionally it is connected to the chorda tympani nerve. Okay, that means two nerves are there which are connected to this particular ganglia. Next, if you see the submandibular ganglion, what is the location of the submandibular ganglion? First of all, it is very small. I hope you have seen a pin. So the tip of the pin, the rounded tip of the pin, okay, the ganglia is just like that, very small. Okay, in dissection hardly you can see. It's very difficult to see the ganglion. I am not telling that you can't see. It's very difficult to see the ganglion. Next, what is the location? The submandibular ganglion, where it is situated. What is the location? If you see the location, it is fusiform ganglion lies on the hyoglossus muscle, just above the deep part of the submandibular salivary gland. So it is situated, or it is lying on the hyoglossus muscle. As I said, hyoglossus key muscle. Every time we are mentioning about the hyoglossus muscle. Okay, so it is situated on the hyoglossus muscle, just above the deep part of the submandibular salivary gland. Okay, now it is suspended. Okay, it is suspended by two roots from the lingual nerve. That means it is in hanging condition. Okay, so above lingual nerve is there. From lingual nerve, two roots are coming, and the ganglia is suspended from the lingual nerve with the help of the two roots. Okay, so that is the location, particular location of the submandibular ganglion. Now let me show you the diagram. Yeah, can you see the ganglion? Submandibular ganglion. This is the submandibular ganglion. See, this is the submandibular ganglion. Now, as I said, submandibular ganglion, where it is situated? It is lying on the hyoglossus muscle, above the deep part of submandibular salivary gland. Okay. Next is, it is suspended from lingual nerve with the help of two roots, as you can see. So which nerve is this? This is the lingual nerve. Now you can see from the lingual nerve, two roots are coming, and this particular ganglion is suspended from the lingual nerve with the help of two ganglion. Okay. Next, what you have to know, though it is a ganglion. Now what is ganglion? Already we have discussed. That means it will be having some connections. In our body, it is having connections. That means some fibers will come into it and some fibers will go out of it. Okay, that is the connection. Now the question is, which fibers, from where those fibers are coming inside the ganglion, and which fibers are going out from the ganglion. Once they are going out of the ganglion, where they are going. Okay. Now before going to the connection, in the types of ganglia, what I have mentioned that it is of two types, sensory and autonomic. And in autonomic, what I have mentioned, sympathetic and parasympathetic. So what is the speciality of the parasympathetic ganglion? It is situated near the viscera or embedded in the wall of the viscera. Now in this case, what are the viscera? In this submandibular region, what will be the viscera or the organs? Those will be the glands, submandibular and sublingual salivary gland. Can you see the location of the submandibular ganglion? It is located near, not it is embedded directly, but it is situated near to the submandibular and sublingual salivary gland. So that is the property of any parasympathetic ganglion. Okay. Next, as I mentioned, connections are there. So you have to understand the connection. Okay, what different types of connections are there? What is the meaning of connection? Connection means some fibers will come, as you can see in the diagram. Okay, see some fibers are coming like this, going into the gland, and some fiber from in the ganglion, and from the ganglion some fibers are coming out. Okay, so that is the connection that you have to understand. Okay. Now, in order to understand the connection, you have to know it is having both type of fibers. Sympathetic fibers are also there, and parasympathetic fibers are also there. Two different types of fibers are in relation with this particular ganglion. Okay, that we have to understand. So, first connection and branches, we have to see about the secretomotor fibers. What is the meaning of secretomotor fibers? The fibers which controls the secretion of submandibular and sublingual salivary glands. So I am talking about those fibers. Okay. Now the secretomotor fibers will pass from the lingual nerve to the ganglion through the posterior root. Okay. So though these are parasympathetic fibers, so in case of parasympathetic fibers, two parts are there: preganglionic part and postganglionic part. Okay. Now here the preganglionic fibers, they arises from the superior salivatory nucleus. Now this superior salivatory nucleus is present in pons. Pons is a part of brainstem. Okay, pons is a part of brainstem. So the fibers from where they are coming? They are coming from the brainstem. So from there the fibers which are coming out, these are which type of fibers? Preganglionic fibers. Okay. From there the fibers will come through the nervus intermedius, then chorda tympani nerve of the facial division, then lingual nerve, and from the lingual nerve it will go to the ganglion, and then it will rely over there. Okay, as you can see, the parasympathetic fibers preganglionic. Okay, they arise from superior salivatory nucleus, pass through nervus intermedius up to facial nerve, then chorda tympani, and then lingual nerve to reach the ganglion. Now in the ganglion they will rely. Okay, the preganglionic fibers. Next, after relying, the fibers which are coming out from the ganglion, these are postganglionic fibers. Okay, these are postganglionic fibers. So from the salivatory nucleus to ganglion, these are preganglionic fibers. Next, from the ganglion to the organ, those are postganglionic fibers. Okay. Now, as you can see, the postganglionic fibers of this which arises will go and supply the submandibular gland. Okay, and which are having 5 to 6 branches. So that will come out from the gland, and then it will supply the gland, because the gland is very near to the ganglion. For your reference, please see the diagram. Now in this diagram, first of all, you can see this is the pons. So in the pons you are getting the superior salivatory nucleus. Okay, when we will discuss the pons, at that time you will come to know in the cut section of the pons the superior salivatory nucleus. Okay, so from the superior salivatory nucleus you can see the fibers which are coming out. Okay, through facial nerve, and then chorda tympani, and then lingual nerve. You can see the fibers is going and relying into the submandibular ganglion. Color codes are given so that you can understand. Okay, once it is relying over here, after that what will happen? From here the postganglionic fibers which are coming out, they will go and supply the submandibular gland as well as sublingual gland. Okay, so this is the ganglion. From ganglion the fibers which are coming out, postganglionic fibers. They will go and supply the sublingual gland as well as submandibular gland, both. Okay, so from this particular part, superior salivary nucleus up to the ganglion, these are preganglionic fibers. Okay, and the fibers which are coming out from the ganglion after villi, those are postganglionic fibers which directly supplies the organ. Now in this case you can see the ganglion is situated very close to the viscera. Can you see the location? See, this is the location, very close to the viscera, okay, or very close to the organ. So this is the connection for secretomotor fibers. Secretomotor fibers will control the secretion of the gland. Okay, so secretomotor fibers are purely parasympathetic in nature. Okay, next will be the sympathetic fibers. Okay, next will be the sympathetic fibers. Now sympathetic fibers is derived from the sympathetic plexus, which is present around the facial artery. Can you see the facial artery over here? A small portion of the facial artery is shown. Can you see the facial artery in this diagram? See, this is the facial artery. So around the facial artery, you can see a plexus of nerve is present. It is called sympathetic plexus. Now the question is, while explaining about the facial artery, I have not mentioned anything about the sympathetic plexus, right? And it is not written in the book also, you can check. Okay. Why I have not mentioned? Because you will get confused, that's why I have not mentioned. Now in this case you have to know one thing, the sympathetic nerve supply, okay, especially these are vasomotor for the gland. Okay, now how they are coming? First of all, they will form a plexus, and that plexus is formed around the facial artery. Now what is the source from where the fibers are coming? Directly they can't form a plexus, for that a source is required. That from this particular part the fibers will come and then they will form the plexus. Okay, so the fibers in this particular case, as you can see, they are coming from T1 segment of the spinal cord. T1 segment of the spinal cord. Okay, first thoracic segment of the spinal cord. From there the fibers are coming. Now directly the fibers will not go. Okay, the fibers will come and then they will enter into the superior cervical sympathetic ganglion. Okay. Do you remember the sympathetic ganglion which I have mentioned over here? That's why I mentioned sympathetic ganglion. And I have mentioned that sympathetic ganglia are paravertebral and prevertebral. Okay, so this, which type of ganglia is there? Superior cervical sympathetic ganglion. These are paravertebral. Para means on both the side. Okay, either side of the vertebral column. Okay, so this particular ganglia which you can see over here, this particular ganglion, this is the which type of ganglion? Paravertebral ganglion. Okay, now in cervical region 3 ganglia are present: superior, middle and inferior cervical ganglion. Among them, the fibers arising from T1 will go to the first cervical ganglion. As you can see here, they will rely. So this particular part is the preganglionic fiber, preganglionic part. Okay, so from T1 segment, the fibers which are coming out, they will go and rely on superior cervical sympathetic ganglion. So this particular part is the preganglionic part. After relying, the fibers which are coming out, those are postganglionic fibers. Okay, now these postganglionic fibers, you can see, they are forming the plexus around the facial artery. Okay, now from the facial artery, those fibers, they will go through the ganglion. As you can see, they are going through the submandibular ganglion. But in this case, they are not relying in the submandibular ganglion. Why they are not relying in the submandibular ganglion? Because these are sympathetic fibers and this is completely parasympathetic ganglion. That's why these fibers will not rely over here. They will go through it, but they will not rely. Okay, and after that you can see directly it is going to the glands, both the glands, submandibular gland and sublingual gland. Okay, so this is also a connection, and this connection is purely sympathetic in nature. Okay, so postganglionic fibers from this superior sympathetic ganglion form a plexus around the artery. Okay, and they will pass through the submandibular ganglion without relying on it. Okay, and then it will supply the blood vessels in the submandibular and sublingual salivary gland. As I said, sympathetic division is purely vasomotor in nature. What about the parasympathetic? Which type of fibers are these? Secretomotor fibers, and these are vasomotor fibers. Okay, next Okay. So next the sensory root. So sensory root is purely coming from which nerve? It is coming from the lingual nerve. Okay, already I have shown you the lingual nerve. We have discussed about the lingual nerve. Okay. Now from the ganglion, what are the branches coming out? So first of all, you can see 5 to 6 branches which will supply the submandibular gland, and other fibers will join the lingual nerve. Okay, and then will supply the sublingual gland as well as anterior lingual glands. Okay, so these are the glands which are supplied by the fibers coming out from the submandibular ganglion. Okay, if you understand the concept of submandibular ganglion, it will be very easy for you to understand about the nerve supply of submandibular and sublingual salivary glands. Okay, or else it will be very difficult. So I hope the concept of the ganglion is clear. Okay, for your reference, I have added another diagram. Okay, so you can choose anyone, whatever you like, but you have to show the two different parts. So I will request everyone, whenever you are drawing the diagram in your notebook or during the time of exam, okay, for sympathetic and parasympathetic, please use two different colors. Okay, it's not compulsory. If you are using two different colors, then identification is easy, and whenever you are preparing notes, it will be easier for you to understand. Okay, so that is all about the submandibular ganglion. Next we'll go to in the submandibular region. Okay, in the submandibular region, two glands are there. These are the submandibular salivary gland and sublingual salivary gland, right? So what you have studied about the submandibular salivary gland? It is the second largest salivary gland of our body. Next, what is the location? Can you see the location of the submandibular salivary gland? Okay, first of all, you can see the size of the gland is just like a walnut, situated partly below and deep to the posterior half of the mandible. Partly it is situated below and partly it is situated deep to the posterior half of the mandible. As you can see the diagram. Can you see which bone is this? This is mandible. Okay, so the shape of the gland is walnut shaped. Okay, next if you see the location, it is situated posterior and deep to the posterior half of the mandible. That is the location of the submandibular salivary gland. Next, everyone you know that submandibular salivary gland is having two parts. What are the parts of the submandibular salivary glands? Superficial part and deep part. Okay, and those two parts are separated by which muscle? Mylohyoid muscle. Okay, as you can see in the diagram. Okay, so see, this is a small deep part of the muscle and this is the larger superficial part of the muscle, and these are separated by a muscle that is called as mylohyoid muscle, which is separating the two parts of the gland. Okay. Next, if you see the dimension of the gland, it is approximately 10 to 20 gram and it is a mixed type of gland. Histology already we have discussed, we have studied about the salivary glands. Okay, so it is a mixed type of gland. Next, what do you think, what are the parts? Already I have mentioned two parts are there, superficial part and small deep part. Okay, now if you see the superficial part, lies superficial to the mylohyoid muscle and deep part lies deep to the mylohyoid muscle. Deep part is small, superficial part is larger. Both the parts are continuous to each other at the posterior border of the mylohyoid muscle. Okay, both the parts are not separated, continuous with each other at the posterior border of the mylohyoid muscle. Okay, next if you see the superficial part, okay, have you studied about the superficial part and deep part separately? Have you studied this? Superficial part of the gland, okay, it is having two ends, anterior end and posterior end, and along with that three surfaces are there: inferior surface, lateral surface and medial surface. These are the three surfaces and two ends of the gland. Why those surfaces and ends are important? In order to understand the relation of the gland. That's why these structures are very important. Okay, now if you see the anterior end, it is extending up to the anterior belly of the digastric muscle, and posterior end it extends up to the stylomandibular ligament. Okay, that is the extent. Now let me show you the diagram. Okay, now this is a beautiful diagram showing the superficial part of the submandibular gland. Okay, now here you can see this is the anterior end, this is the posterior end of the gland. Next you can see this is the medial surface, this is the inferior surface, and this is the lateral surface of the gland. Okay, again I am telling you why these ends and surfaces are important in order to understand the relation. Okay, you have to mention about the relations. Okay, and why the relations are important we'll discuss in the applied part. So first, in the relation we have to see what are the relation of the inferior surface, lateral surface and medial surface. Okay, so I have shown you the diagram, okay, where you have seen the lateral surface, medial surface and inferior surface. Okay, so first we'll see the inferior surface. Okay, now here you can see the diagram showing the relations of the inferior surface. Okay, so this is the diagram showing the relations of the inferior surface, and this is the diagram showing the relations of the lateral surface. Okay, now in the lateral surface, as you can see, it is related to the loop of the facial artery and attachment to the medial pterygoid muscle. Okay, medial pterygoid muscle and the facial artery. Mainly these two structures are related to the lateral surface. Okay. Next, if you see the inferior surface, see this is the inferior surface. Okay. Now in inferior surface, if you go layer wise, first you will be getting the skin. Then you can see you are getting the fascia, deep fascia. Okay, submandibular lymph nodes. Okay, and the facial vein is also present. So these are the relations which are present on the inferior surface. Now in the inferior surface, a very important relation is there. Can you see in the diagram? That is the cervical branch of the facial nerve. See, this is the cervical branch of the facial nerve. This particular nerve is very important. Okay, so these are the relations for inferior surface, and this is the relation for lateral surface. Okay, next, what is the other surface? Medial surface. Okay, now in order to understand the medial surface, okay, what you have to do? You have to see the gland from lateral aspect. Okay, that means if a person is standing like this, you have to see the gland from the lateral aspect, from the lateral view. At that time, you will understand about the medial surface. Okay, so if you see the diagram, so what do you think how the diagram is taken, or how in which view the image is shown? On the lateral view. So from this side, if you take the image, then you will be getting the medial surface clearly. Now, as I said, medial surface is large. That's why the relations are divided into anterior part, as you can see, divided into anterior part. Okay, then you can see the intermediate part or the middle part relations, and this is the posterior part. Okay, so relations of the medial surfaces are divided into three parts. That you have to understand with the help of the diagram. Don't by heart everything. Inferior surface and medial, this one lateral surface already I have shown you, right? Next is the medial surface. Medial surface is divided into three parts for relations. Okay, so here you can see these are the structures which are situated anteriorly. Okay, the submental branch of the facial artery, as you can see, then mylohyoid nerves and vessel and mylohyoid muscle. These are situated on the anterior aspect of the medial surface. Next, if you see the intermediate part, then you can see the intermediate tendon of the digastric muscle, hyoglossus muscle and hypoglossal nerve. These are situated in the intermediate part of the gland. Okay, which surface of the gland? Medial surface of the gland. Next, you can see this is the relations which are situated on the posterior aspect. So, posterior belly of digastric, lingual nerve, glossopharyngeal nerve, stylopharyngeus muscle, all these structures, these are situated posterior aspect of the medial surface of the gland. Okay, like this every time whenever you are studying about the relation of the gland, especially the medial surface, okay, please divide it into anterior, intermediate and posterior part and then study the relations. Okay. Next, deep part is also there. Okay, so deep part is very small and it is situated on the hyoglossus muscle, deep to the mylohyoid muscle. Okay, you have to understand that. In the submandibular region, I have shown you the layers. In different layers, different structures are present. Okay, in the dissection also, I have shown you almost each and everything. Now, if you see the deep part, okay, it is lying on the hyoglossus muscle deep to the mylohyoid, and both this deep and superficial part, they are continuous with each other at the posterior border of mylohyoid muscle. Okay. Now this deep particular part anteriorly, it is extending up to the sublingual salivary gland. Next, if you see the relation, though the deep part is situated on the hyoglossus muscle, that means medially which muscle will be there? Hyoglossus muscle. Laterally mylohyoid muscle. Okay. Next, superiorly you will be getting the sublingual nerve and submandibular ganglion, and inferiorly we are getting the hypoglossal nerve. Let me show you the diagram. So here you can see this is the deep part of the gland. Okay. Now the deep part of the gland, you can see it is lying on which muscle? This is the hyoglossus muscle. So medially hyoglossus muscle will be there. Now what will be laterally? Laterally will be mylohyoid muscle. Okay. Next, if you see above the deep part of the gland, see above the deep part of the gland, what we are getting? Lingual nerve and the submandibular ganglion, which we have discussed just now. And below the gland, deep part of the gland, we are getting the hypoglossal nerve. Okay, these are the relations of the deep part. Okay. Next, on the anterior aspect of the deep part, okay, on the anterior aspect of the deep part, the duct of the gland is arising. Can you see the duct of the gland? Can you see the duct of the gland? Ye dekho, this is the duct of the gland. On the anterior aspect of the deep part, the duct of the gland is arising. So submandibular duct is also called as Wharton's duct. Okay. Submandibular duct is also called as Wharton's duct. It is approximately 5 centimeter in length. Okay. Now once it arises, it will go forward, and it arises from the anterior end of the deep part, which I have shown you just now. Now when it is going forward, it is lying on the hyoglossus in between the lingual and the hypoglossal nerve. Okay, it is present on the hyoglossus in between the lingual and the hypoglossal nerve. That is the location. Next, it continues running forward between the sublingual gland and genioglossus muscle. Okay, finally when it enters the oral cavity, it has to open. Now where it will open? It will open on the summit of sublingual papilla, on the either side of the frenulum of the tongue. Here you can see. So this is the frenulum of the tongue. Okay. Here you can see the opening of the submandibular salivary gland. The duct of the submandibular salivary gland, it opens over here. Okay. Now for this also a very important applied part is related. We'll discuss about that also. Okay. Now if a gland is there, I hope you know it is having nerve supply, blood supply, everything, right? So in the beginning, when I have discussed about the ganglia, at that time I mentioned, if you understand the submandibular ganglion, the connection, it will be very easy for you to understand the nerve supply of the gland. Okay. Now in the blood supply, as you can see, it is supplied by sublingual and submental arteries and drained by the common facial and lingual veins. Okay, these are the blood supply. Okay, so apart from the blood supply, along with the blood supply, nerve supply is also important for the submandibular salivary gland. Okay, now here you can see the nerve supply of the submandibular salivary gland. Again, it is divided into sympathetic, parasympathetic and sensory fibers. Parasympathetic, these are secretomotor fibers. Okay, sympathetic, what is the function? Vasomotor. And what about the sensory fibers? If any pain sensation is there, okay, that will be carried by the sensory fibers. Okay, so parasympathetic secretomotor, from where the fibers are coming? Same thing, whatever we have discussed over here. Okay, the same pathway is followed. And for sympathetic also same pathway is followed. Okay, let me show you the diagram. Yeah. So here you can see the flowchart. With the help of the flowchart, easily you can understand the parasympathetic nerve supply. Okay, so here you can see superior salivatory nucleus. From there, the fibers coming through nervus intermedius, then it will reach the facial nerve. From facial nerve through chorda tympani, it will join the lingual nerve, which is a branch of mandibular nerve, mandibular division of the trigeminal nerve. Then you can see it will go into the submandibular ganglion. Once it enters the submandibular ganglion, it will rely over here. So this part is the preganglionic. From here the postganglionic fibers will arise and they will supply the submandibular and sublingual gland. So if you study the nerve supply one gland, it is same for the both. Okay. So this flow chart is very helpful. Okay, if you write in the exam with the help of the flow chart, so that is okay. Now this is only for the parasympathetic part. Okay, this is only for the parasympathetic part. And the diagram is also given over here. So you can select any of the diagram, whatever I have shown. Okay. Now what about the sympathetic? Sympathetic, from where the sympathetic will come? Any idea? T1 segment of the spinal cord. Okay, then they will rely in the superior cervical ganglion. Okay, that is preganglionic. From there postganglionic fibers will come and then they will form a plexus around the facial artery. Okay, now those fibers will go through the ganglion without relying on it, and then they will supply the submandibular salivary gland. Okay, and sensory is purely by the lingual nerve. Okay, so that is all about the nerve supply and blood supply of the submandibular salivary gland. Now quickly we'll see the applied part. Okay, while explaining about the relations, I have mentioned that some structures are very important, and that importance you can see over here. Okay, so when the excision of the gland is done to remove the calculus or due to some other reason, the incision of the skin is taken. Now this incision of the skin is situated 2.5 centimeter below the angle of the mandible. So this is the angle of the mandible. The incision has to be taken 2.5 centimeter below the angle of the mandible in order to take out the gland, or if there is any blockage in the duct for due to that reason. Now caution must be taken that there should not be any damage to the lingual nerve while taking the incision or while incising the duct. Why? Because the submandibular duct passes directly over the nerve. As you can see, the duct passes directly over the nerve inferior to the neck of the third molar tooth. Okay, so this is the relation of the lingual nerve with the duct of the gland. So whenever the incision is taken, whenever the gland is removed, care should be taken, or else there will be damage to the lingual nerve. Okay. Now in this diagram, as you can see, the incision is taken over here to angle of the mandible 2.5 centimeter approximately below that. This is the incision line where the incision is taken in order to do any type of surgery or to remove the gland. Okay. Next, another important technique, that is the sialography. Anyone, have you heard about sialography? Anyone? No. This is a very important, interesting radiological procedure. Now, what happened? The glands are there, mainly two glands which are having larger ducts. For example, parotid gland and submandibular gland. In case of sublingual, those single duct is not there. Multiple ducts are coming out, 10 to 15 ducts, and they are opening directly into the floor of the mouth in case of sublingual salivary gland. But in case of parotid and in case of submandibular salivary gland, ducts are there. Now if you see the course of the duct, it is not straight. Okay, it is curved in nature. So what will happen? There may be formation of stone, okay, calculi inside the duct. As a result, the duct will get blocked. ठीक है, अगर duct block होता है तो क्या होगा? What will happen? The saliva will not be able to come out through the duct. As a result, there will be pain, inflammation. Okay, so where exactly the stone is situated, where exactly the calculi is situated, or suppose due to some enlargement there may be compression in the duct. Due to that also the saliva cannot pass through the duct. Now in which exact part the compression or the obstruction is taken place, that you don't know. Okay, and only for that reason you cannot take out the entire gland. If a person is telling that I am having problem in the submandibular region, you cannot take out the entire gland. Okay, so for that what to do? How you will come to know? For that this particular procedure is done. This is called sialography. Okay, now in sialography what you will have to do? You have to inject the contrast media, that also in retrograde direction. Retrograde direction का मतलब क्या है? Opposite direction. From gland the saliva is coming out and coming out in the oral cavity. You have to inject the contrast media through oral cavity and it will go in opposite direction. Okay, so for that, in order to find out the opening, it's very difficult. You just open your mouth in front of a mirror, try to find out the opening of the duct. It's very difficult, most of the cases. So a best technique is done. First of all, we ask the patient to rinse his or her mouth with mouthwash. Okay, once it is done, then we will ask the patient to open their mouth and you will give few drops of lime. Okay, once you give few drops of lime, at that time what will happen? Secretion will take place. I hope you have noticed that whenever you put some drops of lime in the oral cavity, what will happen? Secretions will take place. So that can be seen, and when the secretion will take place, you will ask the patient to open the mouth. Okay, and the tongue will be elevated. So you can see the secretion, saliva from where they are coming out. Like this, you can identify the opening of the duct. Okay, and then with the help of the syringe, we have to inject the contrast media, approximately 2 to 3 ml, not more than that. If we give more amount of contrast media, the duct may get rupture. Okay, because the duct is diameter is very less. Okay, so once we are giving the contrast media will flow in opposite or retrograde direction, and then X-rays are taken. Okay, in open mouth only. So when the contrast media will flow, X-rays are taken, entire duct will get highlighted. If there is any calculus, that can be detected. If there is any compression, if there is any stricture in the duct, that can also be diagnosed. Okay, so that is the importance of sialography. Okay, so here you can see, so this is the duct. Okay, so this is how the contrast media is injected. After that, you can see the contrast media is passing through the duct. Now this particular area, stricture is there, that's why you cannot see the entire duct. Okay, this particular part of the duct is not shown over here. Why? Because contrast media is unable to flow. That's why enhancement is less of this particular area. So like this, we can detect which particular part of the duct is compressed, or stricture is present, or calculi are present. Okay, so that is the importance of sialography. Okay, lastly, the submandibular salivary glands can be palpated. Okay, now this is very important. First, what you have to do, as you can see the diagram, index finger you will put inside the oral cavity into the floor of the mouth, and the thumb where you will place below the angle of the jaw, like this will press, and then if you palpate, you can feel the gland. Okay, now the question is why we have to do like this. Now there is a question. Now the submandibular lymph nodes which are lying on the surface of the gland, there are some submandibular lymph nodes which are lying on the surface of the gland. Okay, now that cannot be palpated bimanually as they lie below the floor of the mouth. Okay, so if there is any swelling, that can be palpated and that can be differentiated. Now देखो, swellings may occur if there is enlargement of the lymph node. Okay, that is a type of swelling, and other swellings are also there. Suppose any infection is there, for that the gland is swelling. Some other structures in that area, swelling is there. Okay, so that differentiation can be done with the help of the bimanual palpation of the gland. Okay. Lastly, have you heard about ranula? Anyone? Anyone? Have you heard about this ranula? It is a retention of cyst in the floor of the mouth arising from the sublingual salivary gland. Okay, it is a cyst which occurs from the submandibular salivary glands, especially from the sublingual salivary gland. Now, in this case, what happens? This retention of the fluid forming the cyst can take place from the sublingual salivary gland or from the anterior salivary gland. Okay, now swelling is soft bluish in color and looks like the belly of the frog. That's why it is called as ranula. Okay, now here you can see the diagram. Okay, in this diagram you can see the ranula. See, this is the swelling, and if you see the appearance of the swelling, it is bluish in color, soft bluish in color. So from there, it can be distinguished. Now this is a swelling, cystic swelling because of sublingual salivary gland and in anterior lingual glands. Okay. So that's all about the submandibular region, where we have discussed everything, including the sublingual gland and submandibular gland also. Okay, thank you.